talk, and you kind of set the stage, and I'm going to remove some of my slides because it might repeat in terms of the ideas. Once again, thank you so much, ESK sir. Let me just check if my slides are being shared. Are you able to view my
Not
slide?
yet. Not yet.
Okay.
Yeah. Yes. The only thing you put it in play mode. Yeah. Great.
Yeah. So I'm going to, ESK sir kind of set the stage talking about Oliver Sacks' work, seminal work indeed. And Usha madam spoke about multiple intelligences, and I'm going to kind of focus further on multiple intelligence, but specifically musical intelligence. And pardon me if I have kind of made it too technical. I'll try to kind of keep, make it simple as I go on. And this is the overview I have thought. Brief note on intelligence, which again, Madam Usha has already kind of spoken about. Musical intelligence, what is it? What is the association between music and other cognitive functions? And what are the benefits of musical training? And does it go beyond the domain of just musical training itself, or in the domain of music itself? And I would like to build a case for music training for all. And what is the need for musical training, whether it's in a clinical perspective or a non-clinical perspective. Maybe next 35 minutes or so, I should be able to cover these points. So yes, when we talk about intelligence, as it has been mentioned by the earlier speakers, it has mostly been considered in a singular entity, especially by psychologists, because the need was to define, to quantify, and to kind of be able to evaluate and predict. And so these were the need of the psychologists back then. And as we move on, if you look at the way different theories of intelligence kind of spread out, from a singular entity to process oriented, in terms of not just what the individual is good at, but how is this individual good at, and how does the individual utilizes his capabilities, capacity, so to say, in solving a problem, in adapting to the environment. Ultimately, if you look at all the definitions, be it Wechsler's or Binet, Kamath, or Binet initially in the earlier 1900s, everything is ultimately, the gist of it is, how is this individual going to adapt to the environment? How beautifully the individual is going to express his unique capabilities and contribute to the society ultimately. So whether you call it as a global capacity, ultimately is it this capacity is utilized in a purposeful manner, in a rational manner, also in a culturally relevant context. And therefore, if you look at these several theories, you can kind of categorize them either into psychometric structural approach, like how Usha madam mentioned, are we going to score based on scholastic performance or academic performance? So you're going to use some psychometric evaluation to say, okay, this is the score and this is the kind of level IQ score, so to say. The other is, of course, the information processing, mainly based on how is individual reasoning, or how is a person going about solving the problem, and how the person acts rather than how much. Yes, if you look at from the Indian philosophy point of view or any other culture, intelligence is not just a singular entity. You could call it as buddhi, jnana, viveka, pratibha. In various schools of Indian philosophy, the word intelligence, if you have to give a rough analogy, there are words like prajna, vak, which has so much stress on scholastic ability because of the tantrika and vaisheshika logical reasoning and part of it, and bhava. So emotional aspect is also involved when you're talking about from an intelligence, how the concept of intelligence is being understood. Of course, if you look at from the Indian philosophical perspective, jnana or viveka goes beyond the mundane understanding of just problem solving or the so-called scholastic abilities. It goes beyond that. But that that's not the main focus of my talk today. So I just thought, just to give a glimpse of how intelligence is being understood in various cultures, and ours, which is so rich in its tradition. So if you look at the psychometric approach to intelligence, yes, we are all aware, we look at IQ score, and there's a normal distribution. That means about 68% to 70% of the individual will fall in that average range. You're going to see this gray portion, and there will be some portion of individuals on either side who are either savants or highly intellectual individuals, which are about 2% or less than that. But the the approach to intelligence through that kind of approach would be either somebody has high score or somebody has a lower score. It's a very, as I said, it's a very singular way of looking at the concept of intelligence. But coming to the process oriented, or what Howard Gardner proposed in his theory, and beautifully stressed and so much on the multiple aspects in which an individual can be intelligent, and not only in one perspective. Of course, later he revised his theory. By 1999, he added moral and existential component also to the eight realm that he talked about as intelligences. So it's again reiterating what ESK sir mentioned and Ushaka mentioned, that it's not how smart that individual is, but what really counts is how you are smart. So this is just a representation of different shades and different colors. So an individual could have multiple shades and colors, and need not be just in whether you have less or more, but shades of various aspects of intelligence in which something is less. So it's not like either this exists or it doesn't exist. So there's no a very clear-cut demarcation of in terms of intelligence. So briefly, what Madam Usha already stressed upon, Howard Gardner did start, working with, in Project Zero. Currently, he's the director of that, emeritus director of that project. But interestingly, he also worked parallelly for his postdoc with the famous neurologist Norman Geschwind. And he then actually got inspired. In a couple of his interviews, he highlights how he was inspired by working with individuals with brain damage, that intelligence or this concept is not like yes or no phenomena, as I just kind of pictorically depicted through this multicolored circles. So what he understood was, if individuals ended up having injury to the brain or due to other neurological conditions, it was like as though there is only some part of the cognitive functions that were affected, but otherwise the individual might still have some of his other cognitive profile still intact. And that kind of made him think further on that intelligence cannot be a unitary phenomena or a singular phenomena. It has to have multiple shades to it or multiple aspects to it. And of course, he went on to work in this project on human potential, which he's still currently working on. But interestingly, in one of his interview, he mentions that I could have easily called it as multiple abilities or talents, but I chose to use the word intelligence and intelligences, although grammatically that's a wrong usage of the word. He knew that by then Piaget had done a lot of work on cognitive development in children and all that. So in some sense, if you look at in psychology, especially if you read up autobiographies of various stalwarts, you'll know that how their personal journey in their life also influenced so much of the theories that they put forth. So Howard Gardner was also in fact interested in sociology, law, political subjects, and he said that the moment I used the word intelligences, it caught the media attention, and people kind of people started talking about his theory and went on to grasp a lot of attention to his theories. Nevertheless, whether you call it intelligences or you call it abilities, the way he kind of progressed from his earlier understanding of just looking at ability to solve problems or create products in a cultural setting, by in 1999 he also added the biopsychosocial potential, because adding, yes, there is a genetic basis to it, but there is also other environmental factors, what we call as nature and nurture, both coming together in helping the individual improve some of these cognitive abilities or multiple intelligences, so to say. So musical intelligence, if you look at it, yes, is an individual who has sensitivity to rhythm, pitch, meter, tone, melody, or timbre. So the individual is able to say, okay, this is this instrument versus that instrument, or this is this pitch. There are individuals who have absolute pitch in terms of able to say, okay, this frequency is this note, especially from a Western notation system, and different meters and rhythm, which are the crux of the structure of music. It's also capacity to produce, create, manipulate with musical patterns. It could be tones, short melodies, creating, composing over and above some of these songs. So you see children just singing Twinkle Twinkle Little Star and then creating their own melody, jingle lines over and above that. Or sensitive to sounds, vibrations, good memory for sounds. Okay, I heard this tune here, that is the same tune as this jingle is similar to that. So identifying patterns basically in an auditory domain. So musical intelligence, or from now on, I would also call it as ability, taking from Howard Gardner's term itself. He says that according to his theory, any modality, now if we go further in musical intelligence or any other domains that he mentioned, it could be naturalistic component or physical component or so and so forth. There are 8 criteria that it has to fulfill. One, it has to have a place in evolutionary history, presence of core operations, susceptibility to encoding or symbolic expression of that phenomena, or distinct developmental progression. So if you talk about music, for example, I'll come to that later, starting from identifying tones, pitch, and then you go on progressing. Or if you're talking about linguistic ability, then you're learning symbols, sounds, phonemes, then you go on to words, and then you make sentences, or then you go on to either phrases or poetry, and so on and so forth. So, and there should be a potential for brain isolation following brain damage. There should be existence of savants, prodigies, and other exceptional people, what Madam called as the core example or the end example of each of these intelligences. It has to have support from experimental psychology and psychometric findings. Now, in the next few minutes, what I'm going to put forth across to you is how music intelligence or research done in the field of music and neuroscience and music and psychology has actually answered all these domains or these criterias for these multiple intelligences. And then I take through the other points that I mentioned. So place in evolutionary history, yes, there was a huge debate. Music compared to language in the field of neuroscience kind of took a backseat for quite some time, maybe because of its abstractness itself. Two, because only a handful of people would find it difficult to live without music following brain damage or injury, whereas language deficit would have a far severe impact on their day-to-day functioning and adaptability to the environment. But nevertheless, in the last 3 decades, lot of research has come about to say that music definitely has a evolutionary role to play. It's not just merely an entertainment or a socio-cultural phenomena, but music, because of its existence in human history from pre-modern human era itself, and there are archaeological evidences for that, saying that music has to play beyond just a role beyond just entertainment. And current neuroscience research actually attributes it to that music is perhaps the best cognitive gym that we can talk about. So it's actually helping the brain or human brain to keep itself fit. And that's again part of an evolutionary theory, adaptability to the environment. So how well you are, how physically fit you are. Now, for example, in COVID times, we are talking about building your immunity. So assuming that you are actually building your cognitive immunity, and you're it's like a prophylaxis for several neurodegenerative conditions, or enhancing your cognitive reserve, which means you are far lesser impacted by any damage to the brain in future. So there are archaeological history to say that humans, and music has been part of human beings for more than 35,000 to 40,000 years. Of course, we do not have fossilated vocal canal, because vertebral canal, because it's soft tissue, but we do have larger thoracic canal, indicating that humans indulged in music and also developed instruments, which means the system of music must have been predated even prior to that. um, so Darwin, of course, we cannot forget him when we talk from evolutionary point of view. He initially kind of set it aside, saying, it's just a precursor for human language. Music does not play an important role in our lives, does not have any adaptability, adaptable value in our thing. And it added to that was Steven Pinker, who is a philosopher who works at MIT, cognitive scientist, who added saying that it's just an auditory cheesecake. It just kind of activates other adaptive functions like language, but music per se does not have any role to play in our lives. But as all good scientists, they acknowledge their mistakes and errors, and they continue to learn and evolve. Darwin, at the fag end of his years, he said, if I had my life to live over again, I would have made a rule to read some poetry and to listen to some music at least once every week. So he kind of turned around and said, music does play a very important role in our lives. Now, coming to presence of core operations and susceptibility to encoding, symbolic expressions. We all know music has symbolic expressions, be it with just swaras, able to communicate emotions, or notes, for example, sarigama padanisa, or, you have symbolic expressions of music. In Indian classical music, we talk about, the key structure of a raga. Just by saying a few notes, you can kind of convey, okay, this is this raga, which in fact, Usha madam showed about Abby's video. He's actually showing the jhalak of that raga and able to recognize those ragas. It is also important to note that in the field of neuroscience and psychology, music is considered as from a multiple components approach, which means when I say music, and if I just keep tapping, or I just keep giving a metronome tone, like beep, 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 beep sound, after a while, you'll not say of course, this is not music. So when I say what is music, then you'll kind of define it with, okay, good melody, it has to have some harmony, it has to show, express emotion. There is inherently a timbre. If I sing, then my voice becomes unique, or I use an instrument, then there is a timbre. There's semantics to it. Need not be only lyrics, but if I say I'm going to sing Rag Yaman, and I bring in Komal Nishad, or a note that does not belong to that rag, then the semantics is gone. Or inherent to music is lyrics, rhythm, meter, pitch. Interestingly, why are we calling it as multiple component approach? In fact, it is my mentor and my good teacher, Isabel Peretz, who has worked extensively in this area as a clinical neuropsychologist, looking at how in brain damaged individual, let's say post-stroke or epilepsy or other clinical conditions, where components of these can get affected. An individual will still be able to recognize melody, but would have lost the ability to keep up with the rhythm, or able to recognize lyrics but not able to identify the melody. And so there are case reports basically highlighting the fact that in our brain, all these components, multiple components of music, is represented in different areas of the brain. And ultimately, when I'm saying I'm actually listening to music, our brain is actually like playing it like a symphony, bringing it all together and making us experience music. Perhaps following head injury or any neurological condition, imagine that there is one bandwidth that has got affected, and the person is not able to actually perceive the music as he would have done otherwise naturally. So this is the modular approach to music, actually meeting the criteria which Howard Gardner himself mentioned, that if I were to call this as intelligences, these are some of the criteria it has to put forth. This model, I'll explain it in a simple way. It looks complex, but I'll try to explain it in a simple way. All the boxes in green are actually kind of very clearly associated with music, whereas the blue ones are also associated with language. Now, there is a whole lot of debate whether music and language are different, or is music kind of, it's like hen and egg kind of phenomena. Are we able to say that language came from music, or music kind of is an add-on and things like that? But what we know now today is that there are cognitive processes that overlap between music and language. Of course, from a brain level, there could be unique areas which are associated with each of these cognitive processes, that is music and language, but there are also areas that overlap. So, for example, if you're talking about, uh, you know, like prosody, in musical prosody and language prosody, there is an overlapping area that would take care of that. Or rhythm or meter, there is some kind of rhythm even in language. So today, a lot of work is being done to understand if rhythmic cueing can help in language acquisition and phonological processing in children, especially children with dyslexia, and so on and so forth. So coming to musical intelligence as a distinct developmental progression, yes, of course, we all as parents and as individuals who have learned music or engaged in music, we do know there is a developmental progression. But the key message that we today know from a lot of research that has happened in the field is all neurologically intact individuals appear to be born musical. You may say, I'm not good at music, I may not, and I've not been trained in music, but if I start singing and I sing a wrong note, uh, 95% of you will say, oh, there is something not okay. You may not be able to say whether that swara was wrong or this swara was wrong, but you will say that, okay, this was not okay. Or you'll be able to differentiate between amateur singers versus, you know, highly trained singers. So that capability is built within us. It's just like on a continuum, like an IQ score that I just showed you a bell curve, like a, you know, the curve that says how is the distribution. Same thing with music. Some percentage of individuals turn out to be professional musicians or go on to be famous singers or musicians, but majority of them will have some musical ability to appreciate music, process music, engage in music. So it's a biological phenomena, it's a universal phenomena. So we're not talking about the extremes here. I'm talking about what we generally see across normal. And prior to age 1, pre-linguistic infant, that means a baby which is still not acquired language skills, still show remarkable musical abilities, sensitive to musical scales, temporal regularity. They do show preference over rhythmic, you know, lullabies versus they wouldn't appreciate a non-rhythmic rocking of the baby while putting them to sleep. So there is an inherent liking for rhythm, temporal regularity. And even as young as 2-month-old have shown to prefer consonant music over dissonant chords, and um, recognize by 3-year-old they are able to recognize happy in music, able to say, okay, differentiate between happy versus sad, like you bring a minor note or a major note. And by 6-year-old they're able to differentiate shades of other emotions like fear, anger. And in our own study that we carried out in NIMHANS, what we found was that by 10 to 11-year-old children are performing like adults in terms of appreciating differentiation in tempo, pulsation, or the raga structure. They may not be able to say it like adults or musicians, but they have their own terminologies to say that, okay, I do differentiate, and I'm able to differentiate them as happy and sad. Again, a bit complex slide, but I'll take you through that. By 6 months, you know, children are able to discriminate sounds in all musical systems, just like in language. A child has the ability to learn any language. So just depends on cultural exposure and so on and so forth. And by 12th month, children are able to, you know, are able to discriminate native music, but has slight difficulty in discriminating non-native musical sounds. Like Western babies would perhaps more, you know, exposed to chord system, whereas our children would be more exposed to the raga structure, and depending on the environmental nurturance that the child has got. Similar to language. So there is a developmental milestones that get acquired over the years and the months for language acquisition, and there are similar acquisition that happens over in the musical domain as well. These are typical development. I'm not talking about the atypical development in terms of music and language development. Coming to the existence of savants, prodigies, and other exceptional people, there are innumerable examples. But what we need to remember and not forget is, one is the genetic factor. There are environmental factors. Do not forget the number of hours of practice. So if you listen to the interviews by Lydian Nadaswaram or even Mozart, for example, we say he was a child prodigy and all that, but do remember that he started formally learning at age 3, and his father gave him all the facilities that a child could learn. And the opportunities also do matter when we're talking about having a potential that you're born with. You may be a child prodigy, but then what is it that you get from the environment also matters a lot when we are talking about keeping these exceptional abilities to move forward as they grow. Now, the last 3 points are key. Potential for brain isolation by brain damage, or support from experimental psychology or psychometric findings. As I said, all these 8 points are being addressed or as being researched upon from in the field of cognitive neuroscience. There are labs which are focusing only on from a music theory point of view, evolutionary history, evolutionary psychology, and some which are looking at only developmental perspective, clinical perspective, or intervention perspective, and so on and so forth. So what do we know as of today is that, of course, music is ubiquitous. It's universal, as I said. It's biologically based. It has, as I said, enough evidence to show that it's not just a socio-cultural phenomena. It has unique as well as shared basis with other cognitive processes, such as language. So one key thing is that it is tremendously demanding task. It means even when you're not actively engaged in music, you may not be playing an instrument yourself or not singing, but even while you're passively listening to music, you're actually engaging a lot of your other cognitive functions, such as perception, attention, information processing. Without your knowledge, you're tapping to the rhythm. So there is a motor coordination that happens, engagement of your motor pathway, and socio-cognition and emotion. So there are recent research that says when you're listening to music, your brain is actually syncing up with the musician himself. So there are EEG studies now being done, studies between musicians, like in our kacheri, we have the main vocalists and the percussionist. So there is an active engagement in music, but also there is a syncing that happens between these individuals. So in true sense, what Robert Zettore, the leading researcher in the field, has written a paper. It's called Music is Food for Cognitive Neuroscience. Music has actually helped us understand a lot more about the brain function, which still remains as an enigma. And there's a lot more to study as well. So this is just a figure that I put forth to show that when you're talking about music, you're actually engaging the whole brain. It's one of those unique phenomena that you can talk about. So you're engaging your prefrontal area when you're talking about attention, you're keeping up with the rhythm. Music is something that evolves over time. It's not just like in one time. You have to be there. There has to be engagement with the lyrics or emotion. You're reading, if you're either reading Indian lyrics or our swara system or the composition, your visuospatial area is activated. Your motor coordination has to be there if you're playing an instrument or singing. So there is dynamic process that's happening in a real time as you're talking about being engaged with music. So in another figure which actually shows what are all the different pathways in the brain, like how in the last part of Dr. Usha's talk, she mentioned about billions of neurons and their connections and interconnections. What we know now today is that there is no one area that we are talking about that will get engaged in a given cognitive functioning. For example, if you say attention, of course your prefrontal area is activated and it's very, very crucial. But there is also a whole lot of network that you're talking about in the brain, multiple areas that gets engaged when I'm talking about attention. So ultimately it's like in a symphony, you have a music composition that's written for a violinist or a pianist, but then you have other musicians who are also engaging to enhance this performance. You cannot have a symphony with just one person. So it's just the same way in the human brain. So when it comes to music, you have basic auditory processing because it's an auditory domain. But there is also musical syntax network, so higher order musical features. You're not just just saying, okay, it's just a beat. You're again getting engaged with, oh, what was the higher beat, what was the lower beat, where was the khali, where was the sum in Hindustani terminologies, or okay, this lyric is coming here or there, and things like that. Attention and working memory network, which I have highlighted so far. So you need to keep up with various components of music. Memory, of course, recognizing the song, the lyrics, the melody, remembering the structure, the phrases. Motor network is very, very crucial. We think that, okay, when a person is just singing or playing an instrument, he or she is not engaging as much as an athlete or a dancer. But remember, when you're actually singing, your whole motor pathway is actually getting activated, because without that, you're not getting that meter or rhythm or in place. So, and then of course, emotion reward network. We do know that music is like, it's like chocolate. It's like a drug. We get hooked on to songs. We love music. Once again, another reason why it's so universal is because it activates the reward system in our brain, the nucleus accumbens, and so much so that it can overtake other basic needs also in some individuals, that music takes over priority. uh, so the key point is in this slide is that you have multiple pathways that gets engaged when you're talking about music and musical processing. I'll quickly run through some of the work that we are doing just to highlight how important music is in terms of other cognitive processes. So we are not, as psychologists or clinical neuropsychologists, I'm not interested in making my patients musicians. That's not my aim. My aim is, if I use music as an intervention, am I going to see changes in other domains of functioning which will have value for this individual in adapting to his or her environment? If I take a child, for example, with autism or child with learning disability, my intention is not to make this child a musically trained professional musician, but can I use these techniques to enhance, let's say, social cognitive processing, child's eye to eye contact with the parent or some other important other caregiver, or language processing? Can I help the child acquire some linguistic abilities through music? The reason being, music is very appealing to kids, to elderly, to it kind of cut across lifespan. So in fact, studies have shown that adherence to music-based intervention is far, far better than just physiotherapy or occupational therapy or other forms of cognitive remediation, because music in that way is very engaging. People do enjoy doing music-based intervention. So what we are looking at in our setting at NIMHANS is looking at how rhythm perception, for example, different aspects are there. Again, as I showed it initially, modular approach or hierarchical approach to music. Rhythm per se has multiple components. There is beat. I may just give you tuck, 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 tuck. I can go on giving you this beat. Above that, I may say tick, tuck, tick, tuck. I bring in a component of another dimension to that beats. Or I can bring in meter. Then I can say, okay, thin, thinna, dinna, dinna, 1, 2, 3, 1, 2, 3, 4. So I bring in a meter. So there is structure in rhythm. You may have music which just have pulsation. In Hindustani classical music, you have jorjala. There is no percussion instrument, but you still have um, a pulse coming through. So what we studied was looking at this beat perception in patients with Parkinson's disease, because basal ganglia, there's one area in your brain which is at the medial area. That means in the middle part of your brain, which plays a very important role in motor coordination, attention. It also plays an important role in other higher cognitive functions, but especially in Parkinson's disease, this area is affected. So what we looked at was how these patients have deficit in rhythm perception, but also it correlates with their other functions, like not in the musical domain. And what we also found was this: the performance in rhythm perception also predicted their performance in non-musical domain of attention, working memory, and information processing. It's very, very crucial. It may seem very obvious to some of you, saying that, oh, it's well known that music improves cognitive function, but from a scientist point of view, you're building small brick one at a time to build evidence that yes, music can be used to enhance cognitive functions in other non-musical domain. So the key point is when you're talking about this transition from basic science to application, especially when it comes to the human brain, it has its unique feature that's called neural plasticity. So learning, even Howard Gardner in his work, he mentions that there is scope for learning, there is scope for as you can improve your capabilities in each of these domains. Now, how do we learn? Basically, our human brain, as I said, is like, if you talk about it as a network, uh, the more you use it, the better it is. So if you don't use it, you lose it. That's the kind of principle. So constantly it's interacting with environment. It can be an external environment or internal environment. Our own thought process, our own thinking can have impact on the structural functioning of our brain. So which is of course very well established in from the Indian philosophical system. What we think, what we say, what we do can impact our brain function. Similarly, the unique feature of the human brain is this neural plasticity. And the whole crux of this research that's happening with trying to understand relationship between music and cognitive functions is ultimately leading to, when I use music in a non-musical context, I can bring about changes in, improve cognitive functions. So in a very simple term. So what impacts this neural plasticity? Each one of us have it. It's not that a child with autism will not have it, or a child with mental retardation will not have it, or with intellectual disability in that sense. Each one of us, and it is a bygone theory that we all stop learning after age of 16 or 18, and we start declining from 30 onwards. Today, what we know is that neurogenesis, that means neural plasticity, can happen even till we are in the deathbed, which can still have scope to learn. There is still neurogenesis happening, new connections between these neurons happening. Of course, environment, genes, hormones, maturation, our diet, the amount of stress that we go through, different diseases, clinical diseases can impact this phenomena. But what we are also looking at it, if music listening, passive music listening can bring about changes in chronic conditions, even like schizophrenia. We published this recent work looking at even one-time music listening can improve attention processing in chronic conditions. And this would be the way forward, because improving cognitive functions in various neurological conditioning, including autism, is crucial, because that's what helps us to adapt to the environment. Okay. Anyway, I'll skip one or two, but just to highlight that neural plasticity, musicians are considered as the role model to understand this phenomena of neural plasticity. And studies are being done to look at how musical training can impact children in their non-musical domain of functioning, bring about structural, not just functional, but also structural changes in children in the recent times. So the debate whether what role music plays in our role can go on. That really is not our concern. But there is a reciprocal relationship between music and other brain functions. And since music can stimulate complex cognitive, affective, and sensory motor functioning, the whole new prospect that we have is using this neuroscience model in music-based intervention. I'll quickly take this opportunity to kind of differentiate between therapy and therapeutic. When we say music is therapeutic, yes, everybody knows engage in music will be therapeutic. But when we say I'm using music as therapy, then remember that it has to be provided by a clinician, trained therapist, because it has to be tailor-made with specific goals. So not it's sad that sometimes musicians think that they can be therapists. Musicians can be good musical trainers. They can train music. But when I'm using it in a therapeutic context, it has to be delivered by a therapist, because then you know, okay, what is it that I'm targeting through my therapy? Quickly, as Madam mentioned about stress levels, we did try to study if music can help these patients who have undergone spinal surgery. What we found was that, yes, it can help to reduce their anxiety levels. So we did cortisol level evaluation in these patients. Cortisol is very finicky. It did not give us any positive results, but we did look at anxiety and self-perceived pain perception, and it did impact these patients who underwent spinal surgery. We also developed a module for patients, exactly taking the model that Madam Usha mentioned earlier on, in the HPA axis, the stress level increase, the cortisol level increase, and that's true of even diabetes 2 mellitus, because lifestyle stress is a very core issue which needs to be addressed, and music definitely can be an answer to help these individuals. And we found that uh, music intervention for about 20 sessions did help patients reduce their stress levels and thereby their sugar levels.
Dr. Hegde, another 3 minutes or so.
I'm done. I'm done. Just last two slides. So the whole model of using music intelligence, music ability is ultimately looking at tapping this unique feature of the brain, that is neural plasticity. And you can use it in a clinical domain, in a clinical context, or an educational context. Ultimately, even education, what training that we are giving to our children is ultimately helping the child to form new connections in the brain, bring about structural and functional changes. So just to summarize this, that if going back to Howard's model, that although music and rhythm is part of the intelligences, what I found through research and in the field of neuroscience is that this music and rhythm ability actually taps to all other intelligences. So in a way, you cannot say that one person is good with only one. For example, if especially music, you could have logical and mathematical ability that gets engaged. You need to calculate rhythm, you need to know calculations quite well. So there is Mozart effect that was very famous, which got refuted as this theory, but then we do know music skills can benefit other cognitive functioning, including logical and mathematical skills, attention, visuospatial skills. It is definitely with bodily kinesthetic movement. You're playing an instrument, it will tap into your kinesthetic movement domain, intelligence or ability. You're talking about interpersonal, intrapersonal, social abilities. Yes, if you're a good musician, you're getting musical training, you're sending your child to music training, you are engaging that child in a group phenomena. That child has to understand the emotion, interact with the other musicians in the symphony or in the training program. Intrapersonal too. For many, it can be a spiritual pursuit, as it was mentioned earlier. And visuospatial. If you're talking about how an individual learns saregama or sargam or music, there's a lot of visuospatial ability that gets tapped into. So in some sense, if you're talking about music as an intelligence component of taking Howard Gardner's model itself, it actually taps into all other intelligences also. So maybe it's because I'm passionate about music, but I'm saying that musical training can definitely help to improve other functions as well. So just to summarize, intelligences, I call it ability or cognitive socio-emotional functions. The term really doesn't matter. Let the term be taken over by the the psychologist or neurologist or psychiatrist and educationist. But for lay people, the term really doesn't matter. What we're ultimately talking about is this ability for the individual to adapt to the environment. And I reiterate that all neurologically intact individuals are musical in nature. So it's not like, I'm not musical, I don't have musical skills. All of us do have. It's just on a continuum. You may be good at something, you may be a little poor on the other things. Musical abilities, as I highlighted, engages other intelligences in more than one ways. So bodily structure, bodily movements, spiritual, intrapersonal, cognitive, emotional, naturalistic. So in getting inspired by nature, everything. And music has a strong biological basis. The best cognitive gym, emotional gym that you can talk about. So the moving forward is music-based interventions for children or adults, or it cuts across all lifespan. So here I end. So This is some of the pictures from our lab at NIMHANS, and I should thank all my team members, my mentor, Gottfried Schlag, as part of our work that we are still carrying on, and neurologist Pramod Pal, Venkat Subramaniam, Saini, everybody. Like, it can't be one individual's work, and all my students who are also working with me in several research projects. And maybe during the question answer sessions, I can give specific details on each of those. So thanks a lot. Thanks a lot.
Thank you, Professor
Yeah.
Shantala Hegde. Excellent exposition on musical intelligence. And I think we all know a lot more now about musical intelligence, having heard you. Thanks so much. We have quite a few questions on Q&A, chat, and so on. So I'm going to sort of put them to our two panelists and a couple of emails as well. So let me start with the first question. Can there be a mild case of autism? Are lonely children mildly autistic? Can I ask Ushaka to answer that from QCOM BTD? Akka, please unmute. You're muted.
Can I hear the question once again? Yeah. Can I have the question once more, Doc, please?
Yeah. Are lonely children mildly autistic is the question.
No. Loneliness can come for so many other things. Again, it can be the way the child has been reared. The child might be highly sensitive, very socially, acutely sensitive. There might be anxiety, and sometimes might be happy being a loner. A person who is reflective may be a loner. What is the difference? When they have to change, they can easily change. There isn't a difficulty. They are aware, but they are different. It's different to come out of it. But yes, in autism also, at adolescence, there is a huge hormonal change, anxiety overflow. The child might choose to be alone, but don't mix the two. One is a neurodevelopmental and one is this. The difference in a lonely child is you give him the right arm and around he'll come and he might go back, but he knows how to interact. Here our child may not have that, may have sensory or other blocks coming in the way.
There's another question which I think you should take, Ushaka. How does one expand their linguistic intelligence?
For whom? For everybody?
For everybody. I think it's a general question from an anonymous attendee.
Yeah, the linguistic ability of everybody starts in the beginning, like Dr. Shantala said so beautifully. The child before 1 year can take in the sounds of every living language. Typically, if it's a nuclear family are working outside, no one is talking to the child, vocabulary will be depleted. The brain is remarkable. Like she said just now, it's use it or lose it. You do not start talking. You do not give opportunity. It comes with love. You talk, listen to the child. How many of us listen to our children? Only when you listen to those neuroplast, things come, those interconnections, feel good factor, then they talk back. So it is a lot about how much we've trained them. A mother taking a child from school can just drag the child into the car or stop to talk about what's happening. So number one, it is the nurture that we were talking about. Also, if it is something else, if it's a neurobiological, it's different. How do you improve what is very good in a child? There's so much happening. You have to take it to the creative realm. Supposing the child is already very good linguistically, leave open-ended things. Get them games. There are so many creative areas for each child now. There are so many hobby centers or whatever. You should use technology, has any amount of things, get him to talk to people. And often so the linguistic ability can come out as writing, it can come out even as music, jingles, lyrics for a thing. And so it is about engaging the child if there is no other underlying factor. And truly it just blazes if the child is given a chance. If he has a linguistic ability, you'll be surprised. Debating, quizzing, all these things. Every moment of the day can be used to exploring linguistic intelligence.
Thank you, Shaka. We have two questions from Purnima Rajan, clinical psychologist. The first is, how often is a savant seen in individuals with autism? And when do you start to look for if there is a savant? I think maybe I'll try and take that question. I think savant skills are something that emerge as we work with people. They are not something we aggressively look for, nor should we be making an attempt to kind of develop a savant skill. But it's more that as we work with the child, we come to know that the child has peculiar interests or focus points, which then also lead us to explore and understand peculiar abilities. And that's when we start talking about savant skills. Um, so I don't think there's a particular time to this, but I think all of what we are trying to do today is to highlight that despite any form of disability, a person would have unique intelligences, unique skills, unique proclivities that families and educators and professionals need to work on. Her next question, I'll pass this on to Shantala.
Excuse
Yes,
me, doctor. Can I just add on one thing to your very
sure.
one of the leadways, I mean, it's autism, and if it's savant, is the connected to multiple intelligences, the early developmental history. That's your criteria. This boy who sang Mohanam at 2 years, he had made his own orchestra in the kitchen of the kitchen utensils with the rhythm. The neighbor shouted, so he shut himself into the kitchen. His game was musical, his rhythm was musical, so it shows up by his own doing. So sometimes for a savant, you don't need to teach exactly what you said. It's there, we have to observe. And that's true of multiple intelligences. You've got to observe the child. If you don't observe it, you don't get it. Can't test it out in a half an hour. Yeah.
Thank you.
Yes. Thank you, Doctor.
For a non-savant child, Shantala, I think you can take this. How can we use music to help enhance learning, and whether it can help in social and interpersonal development?
Yeah, I think that was kind of the whole summary of what I spoke on, is that musical training, you should, as like, you should never force a child. If the child really doesn't like, then you should not force it. But if you look at it in a naturalistic setting, every child would have some musical skill. Either they would, for starting from lullabies to singing rhymes to some shlokas and everything. So it all depends on how you would like to utilize the setting in your house or in your family setting, that you give this nurturance. It need not always be a formal musical training, send them to a great teacher. No, you could still start with simple teaching of shlokas or songs or rhymes or anything that the child engages in. Just help them focus on the rhythm component, the tone component, the melody, the lyrics. Child will just pick up. It's like, a rich ground there. They just grow. You don't have to even worry. And music, as I said, is very engaging. Every child would love, you ask any child in their school, they would enjoy the music class or the PT period, because there's no such framework that's always kept. Yeah. I don't know if, I hope I answered your question, because that's like the gist of the whole talk that I gave on how music engages all cognitive functions.
Thank you. There's a question from Shirin Maman. How can a person's intelligence be assessed and a profile created? Is there a separate information processing pathway for each specific intelligence? Let Shantala take that first, and then maybe Ushaka can add if she would like to.
Yeah. In the psychological setting, often when we talk about intelligence testing, we still go by the psychometric approach. So we do a lot of psychometric evaluation that will give you a profile. For example, in children, we do profile them on occupational self-help skills, language abilities. There are some neuropsychological tests that are used for musical abilities also, but it will not give you a score like an IQ score, but you would get some psychometric end of the day, a standardized validated test that gives you a score. That's how all our research work also happens. So for example, you have test for assessing amusia. Nearly 4% of the population are known to have amusia. Or intelligences as such, you do not have for such specifically for the Howard Gardner's model, but what we use generally does give an understanding of these different domains. Yeah.
Ushaka, anything to add there?
Well, to add on, typically in every discipline, suppose you're talking musical, whoever is running that, the specialist in that would have his own way of coding and encoding. And that's where you go with. You can't do music with numbers. You can't do numbers with music. You stay to what is true. If it's a carpenter, it's what have you brought out as a product. If it's music, it's that. If it's dancing, can she do the mudra? So it is in the process of observation and where you're leading to. And what would be an indicator would be they're ahead of their developmental age. So we need to know what would you expect at a particular developmental age. And they're ahead of it. The discipline itself has its own, the masters are all there in all our disciplines. They will tell you, I would go to them. I would go to the master in a field. If it's a gymnast, then I would go to the gymnast who's a master. If it's a doctor, then I'd go to, rather than having it as a number and converting, because that becomes logical. You're converting a different intelligence into a different realm. You've lost the spirit.
So if I may add in just one point, is that one is the expert approach. So even when we are developing any psychometric tool or anything, then you would do a focus discussion group or things like that with the experts. So what Ushaka just mentioned was to get the expert's opinion on what would you call as high achievers or average achievers and so on and so forth. But if you're talking about evaluation and getting an IQ score, so far in the field of psychology, we still use the scholastic approach or singular unit kind of approach. And then you have different theories. So each test has its own theory which it's built upon. So you're talking about G factor or generalized factor or visuospatial reasoning and things like that.
We are sort of a little bit overwhelmed with questions. So I'm going to request everyone, don't raise your hand. Please type a question in. That's more helpful. We'll go through the list. Thank you. We have a couple of questions from Dr. Radhika Soundarajan. To Ushaka, we communicate with them in words only. How to know the best way to communicate with them so as to be more effective?
Well, Radhika, don't think children with autism don't know language, okay? Now there's receptive and expressive. Like we said, in the process of learning, some have exceedingly good language. Most of our children have self-taught themselves languages. Their difficulty is in expression. So to such children, you can talk the way you're talking. But if the child is primarily spatially intelligent or primarily with music or bodily kinesthetic, he will be demonstrating, he will sign, if he's signing for everything, he wants to know where he's going. The child who is very spatial, we've had children who've drawn out their emotions to tell us how we feel, and now he's an artist. We have to catch what they're doing. So if you communicate to them in that mode, because each intelligence has its own way of symbolic learning, like we had said, that would be a better way. But to say that all of them don't understand words, no. You combine it with the word, they will take their form. A forced communication of saying, come here, sit down, do this. We learned, can I take half a minute more, Doc?
Of course, please.
We had, I think the best example is from the children themselves. We have this boy called Swami, he's an artist now. I showed some of his drawings. We taught him, so he was verbal enough, functional language. We thought we'd teach him appropriate social skills also. So he'd stand outside the room and say, and we taught him to say, excuse me, can I come in? He did it beautifully. Teacher, all of us were proud of our abilities. Till one day, he stood outside and just saw the other children come, this boy coming in. He stood outside the door. He used to go up on his tiptoes, straighten his jacket and say, excuse me, can I come in? And then we found there was no one inside the room. He had learnt the language, exactly what you said, without being able to generalize into the social environment. So you have to combine their people intelligence with their language. Functionally, they'll communicate. So those we have to be careful about. So to answer your question, Radhika, it's very individual. You have to form the profile. You have to go through the tests that you would do to understand where is his difficulty in language. It could be echolalia. It could be, not being exposed to the language. We have many children who are quiet, but they'll write it out. Like the poetry I showed you, their thoughts are of the highest order. And sometimes they couldn't be bothered with our social etiquette. Honestly, it doesn't make sense to them. So we have to see that also. If you truly respect the person, you have to respect where they're coming from.
We have a question from Mr. Varadarajan. Is there a specific dosage of music to help cognitive and neurological disturbances? There's an allied question from Tanya Chowdhury. Are there any certified courses in music therapy in India? So I'm going to let Chantala take both those questions.
Okay. So is there specific dosage? There's nothing as such. But when you're talking about music-based intervention in cognitive remediation itself, we do it in, in session-wise. We don't overdo it. But passive listening to music, there's no limit to it at all. But as I said, there is a difference between something being therapeutic and something that you're using as therapy. So when I'm using, let's say in a condition of Broca's aphasia, or let's say after stroke, then I may have just half an hour session, because after that the patient may feel extremely tired, and it's not prudent to have the whole day session or overdo anything, because brain needs that amount of rest to recuperate and give that time for it itself to heal. Second thing, there are different techniques for different conditions. So like, for example, in neurologic music therapy, we have about 20 different techniques for specific conditions. So I may not use the same technique for patients with aphasia, different type of aphasia, or with motor functions or sensory motor function, so on and so forth. So it has to be done by the trained person. Now to the second question, if there are any certified therapy training centers in India, I am aware of a couple of them, but you cannot compare. It's a sad state, I must admit, that in India we have centers that are giving music therapy training, but it's not as structured as you would see it in the Western countries, because from graduate program to master's program and to PhD, they have a systematic curriculum for people to be trained as music therapists. I have seen in India, especially, suddenly somebody is trained in music. They just go for an online course for 6 months and then they call themselves as music therapists. Remember, when you're calling yourself as therapist, right, you must have some clinical training. You should not rather ethically see patients without proper clinical training, because you may harm. In cognitive retraining itself, I've seen when you don't do it the right way, you can actually bring about negative neural plasticity. There's so much that can happen in the brain. So as I said, environment, what you feed in, is extremely important. So there are one in Pondicherry and in Chennai that I know, that I'm aware that they give music therapy training program. But if you're interested, you have already background in any of the clinical, you may be a speech therapist, you may be an occupational therapist, you may be a clinical psychologist, you may be a doctor, medical doctor, you can look up to the neurologic music therapy website, and you could get yourself trained in that and do it in a proper fashion. I am a trained professional member of the NMT. I call myself as a clinical psychologist trained in NMT, but I will unethical for me to do workshops to teach others as of now. Yeah.
Thank you. A couple of quick subsidiary questions to that. One is, can a type of music have adverse effect, especially in the teens? Is one question. And someone else has asked, how do you provide music therapy for an autistic child? Second question. And the third question is there a structured music therapy program that a speech therapist can use?
Yes. So I'll take the third question because it's in continuation of what I just spoke. For speech therapy, there are techniques that are specifically for Broca's aphasia patients. So there are techniques that you're perhaps already aware of, like MIT, melodic intonation therapy. There is therapy for vocal cord breathing techniques, omrex. There are different techniques that are specifically that can be used by speech therapists. Bucofacial movement, throwing of the air and producing words, and specific techniques for that. Second is what kind of music that you can give for autistic child. Again, it's very individualistic. As Ushaka mentioned, when you're planning to give any intervention, first you need to have proper baseline evaluation. Each child is different. So especially in children with autism, what research has shown is that they have difficulty in processing the prosody. That's why they have difficulty in understanding emotion through language, is because this pitch glide, that prosody that we talk about, like or I say I'm okay, I'm not okay, or you're expressing your emotion through this variation in pitch. Children with autism may have difficulty in recognizing this pitch variation, the prosody, and the connection with the emotion. So often some of the techniques that are used is just the pitch glide, in music therapy session, is to help them appreciate, like ah, so different pitch glide, and then slowly mapping it onto their emotional expression, how we use it in naturalistic communication. Of course, I can go on and on. I'll stop here. Did I miss any third question as I spoke about
Can a
autism?
type of music have an adverse effect, especially?
So an interesting thing that I did not mention in my talk is that the human brain, as I said, it's an auditory, music is an auditory processing, right? So from the middle ear, the cochlea, where transduction happens, that means the physical information that's going gets translated to a neural information, that we call it as transduction. There is what is known as tonotopic representation starting from the middle ear itself. So in the midbrain region and the higher cortical area, there are different areas of the brain assigned to different pitch frequencies. And that's how, training musicians train themselves for hours and hours for pitch perception and pitch accuracy. As I said, there are evidence for negative neural plasticity, but I cannot say, okay, this music is not good for this kind of teenagers or that, because there are a lot of other psychological factors that play an important role when you're talking about musical preference: personality factors, exposure, peer group exposure, how your peer group is actually liking the music. All these factors play a very important role when you're talking about musical preference. Of course, there are some case reports where musicogenic can happen, epilepsies can happen, seizures can happen. That's mainly because the sudden transitions that happen in pitch, like in rock music or in certain kind of trance music, where this glide that happens abnormally, which does not happen naturalistically, can perhaps trigger these areas of the brain, leading to some clinical conditions. But those are very rare. So I hope I answered. It's pretty complex. It's not as simple association.
Yeah. So Sujata Sriram has a question for Ushaka. Can you please talk a little bit about comorbidity of other conditions so that many educators, parents would benefit on that?
Well, typically, from the experience I've had and all the children and all the staff I've worked with and learned from, definitely coexist, because it is a neurobiological disorder. So it can coexist with cerebral palsy. It can coexist with learning disabilities. It can coexist with intellectual disability. It can coexist with sensory impairments also. How do you make a difference? You have to do a differential and understand what is the primary factor, what is secondary. A child with cerebral palsy who seems to have autistic features might simply be because he's not been allowed to move around so much, not given that exposure. A child with visual impairment and hearing impairment often mimics autistic feature. You'll see the same rocking, you'll see the same need for this, easily understood as autistic. Yes, but you'll have to do a detailed thing before you label the child. To be very, it's an eye of the person naturally working with would know this. But yes, it can and does coexist. And on the other hand, you have children just on the light edge of autism. They're almost there, but it's just that little awkwardness that comes. Yeah, there's a whole glide.
Very interesting question from Radhika Mohan. Have you, it's both to both of you, have you any experiences with haptic sensation? Children writing when just given tactile touch, even poetry. What is the physiology behind it?
Yeah, I can, Dr. Shantala, would you like to answer? Should I? See, what happens in the information pathway for autism is everything is fragmented. One does not connect to the other. So I hear your voice, I know what I have to do. So I have understood, there is perception, there's remembrance. But when I have to plan the action, I need a trigger. So sometimes just that touch gives them the proprioceptive feeling and they get onto it. It's a part of their need. Sometimes sensory integration therapy helps, but yes, there is a need. We will find children with autism touching the wall. They just get a certain feedback which is required by their sensory thing, and also to jog the memory. If you read, I would recommend for those of you really interested, and where I learned a lot from is Donna Williams' Autism Inside Out, and inside out approach. She beautifully does it all, and from all the children I've seen. So this is a very important question you've raised. Yes.
Yeah. I think Usha covered most of those points, and it's mainly with difficulty with integrating multiple information also. So children with autism have difficulty. So too much of stimulation, too much of information is definitely not the right thing to do. So that is why they find it difficult to cope in social situation, because there's too much stimulation already. They're hyper stimulated. So you need to kind of scale it down, make sure that the information given is in one modality, and then subsequently you help the child to cope with the too many information that's coming through. Yeah.
There's an interesting question from Farhan Nishtar. What are some of the dominant intelligences characteristic in people with a sense of humor?
Sorry? Of the humor.
Intelligences characteristic in people with a sense of humor.
With humor. Well, it really depends. What a beautiful question. Congratulations. Your humor will be according to your intelligence. So it's bodily kinesthetic, you're playing around with your body. You're the mimer, you're doing all the funny things. If it's musical, you're playing around with more music. If it's your linguistic, then you're writing all these limericks and comical things. If it's logical, you're making a quirk of a puzzle. It's fascinating. Your humor, everything you do is a part of your profile. So there's no one standard way. That's why they say children with autism don't play. They don't do pretend play. Pretend play is social play. Social play is interpersonal intelligence. That's the only play they don't have. They're doing logical play. They're doing linguistic play. They're doing musical play. It's fascinating. They're doing sensory play. None of us can stop to watch the bubbles. They can. Because we can't step into their world. We have a... But actually, it's a very good question. Congratulations.
Yeah. It's actually a higher executive functioning, able to encode, able to think from a different perspective, give meaning beyond what is apparent.
One area, there is a flow.
Yeah.
That is what is beautiful. So even in music, someone asked, I'd go back to that question. We have this child who's so good in music. He learned the NIOS because he was forced to. He could go to the computer, get onto anything. He had his own directory of the musicians he wanted to listen to. At the top tip of a button, he would bring it out. Now that's what happens in autism. You give them the space, let them create, they will find. And even when they're running around, most people say, don't run. 10-year-old child, social behavior of a 2-year-old, exploratory. He'll look at everything, he won't do anything. If he's putting everything into his mouth, it's pica. You go to Buddhi clinic, they'll do sensory intelligence. It's because we have not understood the 3 barriers to the potential. Check sensory, check development, check the intelligence, and go back wherever required. Only when it comes together. Otherwise, we're trying to fix the child. The child is shrieking in pain for sensory. The sound is too much. You're teaching him to behave. So much to think about that.
And just one point on humor, that was such a nice question, is that humor also has a developmental trajectory. So if you look at children with age 2 or 3, their humor, they would laugh at something that we wouldn't laugh now, or we would find it silly. So humor is again, has a developmental trajectory.
They laugh because that's very funny too.
And if I can add, I think if you can laugh at yourself, you have good interpersonal intelligence.
Good insight.
Absolutely, Doc.
Yes,
absolutely. That's intrapersonal intelligence, to be able to laugh at yourself. Absolutely beautiful.
Question from Priya Vidya Shankar, and I'm going to link it, other questions about music therapy as well. For children with autism having hypersensitivity to sound, but who are still musically inclined, Shantala, what domain of music can be administered to calm down their aggression or mental disturbance? And many people have asked, what about aggression in autism and how do you handle meltdowns? So first about which kind of music, and then we can ask Ushak also to contribute on how to handle the meltdown.
Okay. One, as I already mentioned, the music should not be too complex because children already are hypersensitive. So if you give them a lot of music, timbre actually plays an important role. The kind of instrument that you use can play an important role. You need to do a proper evaluation of the child's profile before you decide what kind of music you're going to play. So that's again very individualistic and tailor made for every child. There cannot be like one rule for everybody. And also look at the strengths in that child. If the child has good rhythm skills or already is tapping for something, engage the child in already the task that they're doing and then bring in the musical or the melodic component to it. Overdoing is not the rule of the thumb at all. Yeah. I hope I answered it in a
Thank
simple.
you. Thank you. Ushaka, do you want to add how to manage the meltdown?
Yes, that's again a very, very, I'm sure, very important question for parents. First, when we look at a meltdown, we look at it as a social behavior. Can I just share a screen and show one slide here, Doc? Is it possible? We don't have time.
I think a little bit short of time.
Yeah. So anyway, we look at it as a social behavior. Chances are when a child is having a meltdown, 3 factors. One, his social age is much younger. 2-year-old typically throws a meltdown. So if your child is 2-year-old, then that is it. Secondly, there may be huge sensory disturbances in his environment that he's not able to communicate to you. We are only looking at his behavior and saying, don't. The need is to find out what it is. We used to have a child who never went into the toilet and the mother would have great problems. Then till we found they were using a very strong disinfectant. Or the lights are too strong. So go back to sensory. Which sensory area might be troubling him? The way he's being communicated to, exactly what Dr. Shantala said, we're bombarding him with something and he doesn't understand. His only way of communication is to shout. So you need to remove that and clear the environment and watch him for a while. He'll demonstrate beautifully. If there is any underlying need, you must. It could also be unrecognized, this thing where a doctor could help. There's an underlying seizure not expressed. It could be some vitamin mineral thing. It could be purely physiological. You have to look at it that way. That's what the natural therapy also helps. So it's first look at a physical reason. Then look at the sensory possibility. Then look at the developmental age. And then you connect to MI. You will find you won't have a problem. Problem is if you do the reverse.
I'm going to do only 2 more questions simply because I think we've kind of really overrun on time. Can I, at the end of it, we'll all share our emails and people who want to connect with us are welcome to send us an email and ask us any further questions. I do apologize that we're not going to run through every question. We're really overwhelmed with questions here. Two points. One is a good question from Padmini Rambatla. She says, I presume that not all high-functioning autism individuals are to be considered as savants, and that's exactly correct. Secondly, I understand that at times, autistic individuals are functioning from their lower brain and hence can become agitated. Are there techniques to make them to shift their thinking to their prefrontal cortex? Would either of you want to take that?
As I said, this thing of lower brain, prefrontal cortex, it's not really true. The theories really are outdated in that sense. So what you need to actually see is whether this child is able to integrate all this information. So already there is an inherent limitation it's because of the biological basis or genetic factors or whatever that the reason might be idiopathic in that sense. So whatever therapy that we are talking about is starting from whatever earlier was mentioned, looking at if there are no physical irritants, like there is no underlying seizure activity or there's no, too many sensory stimulation that is happening. By calming down, you're actually helping the prefrontal area itself to take over. When you're talking about helping the child to pay attention to one detail to begin with, you're actually engaging the prefrontal area. You're helping the child to relax. You're actually bringing down the subcortical area, the limbic system, the activation bringing it down, thereby the prefrontal area to take over. So you don't really have to think from the brain point of view. What you're doing will have an impact on these brain functions, irrespective of what you. So you don't have to really know the terms in that sense. What I'm saying, as a parent.
I just add in one line. That is very nice, Dr. Shanta. One thing for all parents, and this I learned from Donna herself. She says, just like these children in some areas are hyper acute in sound or this thing, they also absorb your emotions. You don't need to spell. They can sense you. I had a child who says, I can sense you. They can sense if you are calm. Often parents are stressed. Now that stress is naturally transferred on, much like those of us who know when we had young children, we'd be calm, they'd be calm. We're going off for a movie in 5 minutes, they refuse to go to sleep. We are agitated, they are agitated. This continues in autism. So check yourself before you check the child. How are you? Are you stressed out? Are you trying to fix things? Why are you trying to fix? You don't like people to fix us. We don't want anything to be fixed. So understand first, if there is stress, the child is absorbing that can agitate the child. A very important fact.
Can music therapy help modify behavior in a child? Is a question from Vidya Venkatesan and quite a few others. Shantala?
Again, when you say behavior, it's a very, very, very wide term. What behavior is the next question? So if you're talking about pro-social behavior, yes, as I said, engaging in musical training can help the child. Then the next question, as a clinician, I would like to know what age is the child of, or what is it I want to focus on? Is it a problematic behavior, or is it a normal behavior that you want to help the child to enhance with? So all these factors matter a lot. So giving a kind of blanket answer to this would be tough, and it may not be right on my part. But yes, there are.
Mail you and ask.
Yes. They can definitely mail me. What behavior are you talking about? That matters a lot. So.
I've had a couple of interesting questions. One was about why musicians have mood disorders and hyper emotionality. And I think probably there's the works of Professor Trimble are to be kind of drawn to. A nice book called Why Humans Like to Cry, published by Oxford, for example, or Soul in the Brain, which is an earlier book which came out from John Hopkins Press. But I think the answer that he gives you in the books is that the right hemisphere is your creative hemisphere. It is your musical hemisphere. It is also your emotional hemisphere. If you go by the old theories of hemispheric laterality, which of course are constantly being challenged and non-validated and validated. But if you go by that explanation, you will understand why there is more perhaps emotionality in people who are in the creative space. But if you reverse it, if you find someone who is hyper emotional around you, then perhaps you should be looking at unlocking their creativity, because that might be the answer to their being able to achieve their potential, is what one might conclude. Very interesting question, and I'm going to put this to Ushaka, and I'll take this as the very last question. If a child with ASD speaks in sentences but not on demand, does not answer to the questions but describes when wants to, should we force the child to answer on demand?
Can I have that again?
If a child with ASD speaks in sentences but not on demand, doesn't speak on demand, does not answer the questions but describes wants to, should we force the child to answer on demand?
This might be a debate. You have to allow time for processing. If he has understood and he is answering correctly, you have to allow that time for process. There's a thing called word meaning aphasia. That is, they get it, but they have to process the meaning. Give them time. It happens in dyspraxia also sometimes. And when they want to, they talk. Yes. So don't force. What will happen is, it's like me saying, what's your name? What's your name? What's your name? What's your name? And you're bombarding it. You're not giving the time for answering. In many of these things, there's like paradigm shift. What the child can do, we must enable. What the child has a difficulty with because of his genetic thing, which the doctors will tell you, we learn to accommodate, like we accommodate each other. There is that difference. No two children are alike. And for a child who's talking about musical, someone has talked about they're using the computer. Children with autism can, if they're interested in something, you leave them free, they'll reach it. That is the surest, that much I can tell you. What they are good at, they will reach, minus your language and your emotion. We need to step out of it.
So if I can also add, perhaps, I should take you back to the Oliver Sacks story that I shared of the
Yes.
chap who's given a number to calculate and then continues to do whatever he feels like doing, and weeks later comes back with the answer. He's been processing, and the processing is happening in the back of his head, not at the speed or not in the way that you want it to happen.
Absolutely.
Lot of appreciation both in the Q&A and in the webinar chat from many people. So I'd like to say thank you from all three presenters for not just your participation, but your appreciation as well and the questions. Sincere apologies that we've not taken all the questions. We should leave more time to questions is the lesson I'm learning. The next Buddhi Clinic webinar will be on Parkinsonism later in the month. So do follow the Buddhi Clinic page on Facebook, and that way you'll be informed about future webinars and interesting stuff that we do. And I'd invite everyone to sort of go through the Buddhi Clinic video on autism spectrum disorder, which kind of tries to explain in a very simple way the kind of work that we do. I've had a few questions about assessment. How do you assess for autism spectrum disorder? And I think Shantala referred to it in her talk as well. And I want to point out that assessment has to be multidisciplinary, and assessment has to use tools that are validated. For example, the Childhood Autism Rating Scale is a validated tool that helps you assess behaviors in autism. I've had questions about how you assess multiple intelligences. An assessment for multiple intelligences is still something that can only be done by someone who has a lot of experience in doing it. We are launching a very simple discovery kit, and that's not diagnostic by any means. It is more to help you become aware of what the different intelligences are and what may be some key questions you could ask yourself when you are assessing yourself or assessing a loved one. So it's very important to remember that diagnosis is for an expert like Ushaka, but certainly we can help you point yourself in the right direction and start you on a process of discovery. And I think that's really the whole point of today's webinar, that we have, I think, started a process of discovery, of thinking, for some of you, and I'm sure some of you are already engaged in this process of discovery. Before I thank both Ushaka and Shantala, any last words from both of you?
Thank you so much, Doc. This was really very unique. It was wonderful. I want to thank all the participants for your patient hearing and your wonderful questions. If I sent you with one message, it would be understand yourself, celebrate yourself. You are unique. Understand your child, celebrate your child. The child is unique. And you have enough in you to adapt around to enable that child. Don't try to fix it. You'll be surprised at the end result. Go to wait. That is called self-regulation.
Thank you, Akka.
Yeah. I would like to thank you, sir, for inviting me for this wonderful webinar, and many, many thanks to Usha madam, Ushaka. So fondly, you connect, and, thank you for complimenting with your ideas and thoughts. It's really nice. And thanks to all people who are in the audience. I'm not able to see you, but then thank you so much for all your questions and positive note and feedback. And yeah, just like a take-home message, as we said, use it or lose it. So kind of improve your cognitive reserve yourself. So it's not just music alone. So that's why I think that question was relevant. Musicians are also not, immune to diseases or conditions, because music can't be answer for everything. Yes, it is important, but other things are also important. So view life holistically, so spiritually, philosophically, cognitively, emotionally, socially, everything is important. So in this pandemic times, stay safe, stay at home, and utilize this time with this thought, like to work on yourself, and what Ushak also mentioned. So thank you so much, ESK sir, for inviting me. It was
Thank you,
really an
Doctor.
honor, really an honor.
Thank you, Doctor.
To both of
Thank you.
you, and
Thank
thank you to all the participants for a
Thanks.
wonderful, wonderful morning. Please email anything you want to care, at buddhiclinic.com. And from there, we'll connect you with the person you've addressed the question to. And you'll get your answers. So it's care, at buddhiclinic.com. Thanks all. Bye bye, and
Thank you.
stay safe during COVID.
Thank you. Thank you.